The most important principles of a breast self-exam is about looking, feeling, and touching. So you have to look at your breast, you have to touch your breast, and you have to actually feel them. So the first thing we want to do is stand in front of a mirror without your underwear, look at your breast. You're looking at the shape, you're looking at the size, you're trying to appreciate the texture, and you're trying to also look around the nipple for any, change in color. Hello and welcome to another episode of Dr. Ama Speaks, here where we explore health issues that matter most to you, helping you lead healthier lives. I'm Dr. Ama, and today we are going to have an important conversation and a topic that affects millions of women and even some men across the world. And that topic is breast cancer. With October being Breast Cancer Awareness Month, now is the perfect time for us to discuss what breast cancer is, the factors that can increase your risk, and how we can take steps to prevent it. And why early detection can truly save lives. Whether you're in the diaspora or you're at home in Nigeria, this information is relevant to all of us. So now let's get started. What is breast cancer? Breast cancer, which in general we do not understand what cancer may be, but we have an idea what it might be. What is breast cancer? Simply put, breast cancer occurs when the cells in the breast start to grow uncontrollably, forming a mass or a tumor. Now, while it's most common in women, men can also develop breast cancer, although in men it is much rarer, about 1%. There are different types of breast cancer, but the commonest one for the purpose of our conversation today are two types, which is the ductal carcinoma and the lobular carcinoma. Ductal carcinoma begins in the ducts of the breast. These are the ducts that carry milk to the nipple, while lobular carcinoma begins in the glands of the breast. And these are the glands are the parts of the breast that produce milk. Now, breast cancer can arise from there and spread to all other parts of your body if you don't detect it early, which is why understanding the risk factors and focusing on prevention is absolute key. The next question is, what are the risk factors of breast cancer? Let's talk about those factors. There are certain factors that increase your risk tremendously. Some of these risks are things that we can actually change. Meanwhile, some of them are things we have no control over. Let's start with the things that we have no control over. For one, age. As you get older, as we age, the risk of developing breast cancer and different types of cancer increases, especially for women who are above 50 years old. Family history. There are some people who have close relatives like their mother, their sister, their daughter, who have had breast cancer in their life. They actually have a higher risk than others. Then genetics. Mutation in certain genes like the BRCA1 gene and the BRCA2 gene, these are like tumor suppressor genes. They tell your body to kind of fight off tumors. But some people have a mutation in that gene, so their body doesn't know to do so. Therefore, they have a higher risk of developing cancers like breast cancer, ovarian cancer, and other types of cancer. Menstrual history. Women who start menstruating before they turn 12 and women who go on to menstruate even after age 55 are slightly at a higher risk. Now let's move on to what we call modifiable risk factors. These are the risk factors that you can do something about, that you can change. Number one, weight and obesity. Being overweight, particularly after your menopause, this increases your estrogen levels, and this can fuel the growth of certain breast cancers. Alcohol consumption. People who drink lots of alcohol, the greater your risk. Smoking, tobacco. The more you smoke, it is linked to many cancers, including breast cancer. Then physical inactivity. People who don't do much are mostly always laying in bed for one reason or the other, who we call a sedentary lifestyle. They have an increased risk of breast cancer as well. We also need to consider facts like hormone replacement therapy, which is also very important, and certain birth control pills. This can increase your risk of also having breast cancer. However, it is also very important for you to discuss with your healthcare provider to weigh your benefits and your risks. Now let's talk about prevention. The good news is there are steps and there are things you can do to lower your risk of breast cancer. Here are some of those strategies. Number one, maintaining a healthy weight. As we see, obesity is one of the risk factors. So when you're staying at a healthy weight, it's very good, especially after menopause. A balanced diet that is rich in fruits, vegetables, lean proteins, fibers, whole grains, these can actually make a big difference. Exercise regularly. Aim for at least 30 minutes of moderate intensity, like walking, swimming, a little bit of running, on most days of the week. I'd say 3 days in a week. Regular activity can help you to regulate your hormones, boost your immune system, and keep your weight in check. Limit alcohol and avoid smoking. If you do drink, limit your intake to no more than 1 small glass a day. And if you smoke, please consider quitting smoking. And there are lots of resources available if you want to quit. It can actually improve your overall health, not just reduce your cancer risk. Another modifiable risk here is breastfeeding. For women who are able, breastfeeding has been shown to slightly lower the risk of developing breast cancer, especially if you do it for 1 year or more. Now, be very cautious with hormone therapy for women who take it for one reason or the other, either as a form of birth control or as a form of hormone replacement therapy after menopause. Always work with your doctor or healthcare provider to use the lowest effective dose and for the shortest period of time. Prevention is always better than cure when it comes to breast cancer, and making these lifestyle changes can go a long way in protecting your health. Moving on to the most important part of this conversation, which is early detection. This is the most critical aspect of breast cancer. Early detection can make all the difference when it comes to treatment success and the survival rates. How do we detect breast cancer early? Number 1, breast self-exam. Performing regular breast self-exam is a simple way to become very familiar with how your breasts look and how they feel. If you notice any changes, such as a lump or like an unusual discharge, changes in the shape or the color or the texture of your breast, don't just ignore them. Just see a healthcare provider at once. Here's how you can do a breast self-exam. The most important principles of a breast self-exam is about looking, feeling, and touching. So you have to look at your breast, you have to touch your breast, and you have to actually feel them. So the first thing we want to do is stand in front of a mirror without your underwear. Look at your breast. We're looking at the shape, we're looking at the size, you're trying to appreciate the texture, and you're trying to also look around the nipple for any change in color. Compare it with both sides. Look at the right and compare it with the left, and vice versa. After you do that, you want to raise your arms and look for any changes as you move as well. Still in looking, you have to raise both arms because there are certain masses or abnormalities that will not show until you raise your arms. So you do that, look again, and compare both breasts. The next thing you want to do is to touch your breasts. Now, for touching your breasts, you can either do this while you're standing, either in the shower in front of the mirror, or while you're laying down in bed. While you're in the shower, once you have water running down your body, or you can rub a little bit of soap on your fingers, and then you want to touch your breasts. First and foremost, you want to lift up your hands. You can raise your hands up. Use your right hand to feel your left breast. Now, like I said, you're doing it strategically, either from outside in or inside out. Starting from the armpits, you feel inside your armpits. And when you touch, you really feel as well. You push down a little bit and try to rub. Here you're checking for any lumps, or any nodes, or any area that might be tender. You're going to feel it. For this description, I'm going to go up, down, all the way down, and then you go back all the way up again until you get to this bone we call the clavicle, which is the bone at the base of your neck right here. So you want to feel and come up here, and then go down again, and you come up again until you get to the inside of that breast. Same thing for the right breast. You lift up your right hand and feel with your left hand. And you want to start from the armpit, feel either from outside in or from inside out. Strategically, you're feeling for lumps, you're feeling for anywhere that is tender, and sometimes while you're feeling, you might also notice a bit of discharge, and you want to take note of that as well. You can also feel your breast while you're laying down. You put a pillow behind your head, and then you lift up your right arm and feel with your left hand, and you lift up your left arm and feel with your right hand. And you can do this while you're standing in the shower. You can do this while you're laying down in the bed or standing in front of a mirror. Once again, you're checking for any areas of tenderness, checking for lumps or any areas of thickened tissue. After you've done a self-breast exam, the next important thing to do is a clinical breast exam. Here, you're going to get a specialist or a healthcare provider who is trained to actually examine your breast in the presence of a chaperone to check, either to identify or to clarify if there is any of those lumps or any masses or any concerns with your breast. And after doing a clinical breast exam, they may or may not request for something called a mammogram. Regular mammograms are one of the most effective tools for detecting breast cancer early, often before symptoms even arise. In general, women ages between 40 to 49 talk with your doctor and they can discuss about when to start screening. For women who are 50 to 74, you should get your mammograms every 1 to 2 years. It's important. And then for those who have a family history of things like those genetic mutations we talked about, your doctor may actually recommend you getting a mammogram much earlier or more frequently. The next kind of imaging we'll talk about today is ultrasound and MRI. In some cases, especially young women and women with denser breasts, ultrasound and MRI will be recommended in addition to the mammogram. This will help us to actually confirm if there's anything going on in that breast. Early detection doesn't only just save lives, it helps you to also reduce the intensity and treatment required and overall better outcomes for you and for the doctor. So what is our call to action today? What's our action steps today after this conversation? What can you do today to lower your risk of breast cancer and improve your chances of early detection? Number 1, begin by scheduling a clinical breast exam or mammogram if you haven't had any. And prior to this, you should have done a breast self-exam at home, like I recommended, once every month and preferably after your period. Number 2, incorporate some healthy habits into your daily life, like move better, eat better, limit alcohol, quit smoking. Educate yourself and your loved ones. There is no room for ignorance anymore. You can start by sharing this information with your friends, family, your community, co-workers. Together we can try to raise awareness and take steps towards a healthier future. And for my immigrant brothers and sisters and my immigrant audience, living far away from home can make accessing healthcare feel more daunting. Make use of the health services available in your area. And if you're unsure, don't hesitate to ask for guidance from your healthcare providers. Early action can lead to better outcomes when it comes to breast cancer. Thank you for joining me today on this special episode. Breast cancer awareness is not just about knowledge. It's about taking action to protect your health and the health of those around you and those you love. If you enjoyed this episode, be sure to subscribe and share it with others who may benefit. And remember, your health is in your hands. So take steps today to live a healthier tomorrow. Until next time, stay safe and stay healthy. Bye-bye.